Alcoholism is, broadly, any drinking of alcohol that results in significant mental or physical health problems. Because there is disagreement on the definition of the word alcoholism, it is not a recognized diagnostic entity. Predominant diagnostic classifications are alcohol use disorder, DSM-5, or alcohol dependence, ICD-11. These are defined in their respective sources. Excessive alcohol use can damage all organ systems, but it particularly affects the brain, heart, liver, pancreas, and immune system. Alcoholism can result in mental illness, delirium tremens, Wernicke-Korsakoff syndrome, irregular heartbeat, an impaired immune response, liver cirrhosis, and increased cancer risk. Drinking during pregnancy can result in fetal alcohol spectrum disorders. Women are generally more sensitive than men to the harmful effects of alcohol, primarily due to their smaller body weight, lower capacity to metabolize alcohol, and higher proportion of body fat. In a small number of individuals, prolonged, severe alcohol misuse ultimately leads to cognitive impairment and frank dementia. Environment and genetics are two factors in the risk of development of alcoholism, with about half the risk attributed to each. Stress and associated disorders, including anxiety, are key factors in the development of alcoholism, as alcohol consumption can temporarily reduce dysphoria. Someone with a parent or sibling with an alcohol use disorder is 3 to 4 times more likely to develop an alcohol use disorder themselves, but only a minority of them do. Environmental factors include social, cultural, and behavioral influences. High stress levels and anxiety, as well as alcohol's inexpensive cost and easy accessibility, increase the risk. People may continue to drink partly to prevent or improve symptoms of withdrawal. After a person stops drinking alcohol, they may experience a low level of withdrawal lasting for months. Medically, alcoholism is considered both a physical and mental illness. Questionnaires are usually used to detect possible alcoholism. Further information is then collected to confirm the diagnosis. Prevention of alcoholism may be attempted by reducing the experience of stress and anxiety in individuals. It can be attempted by regulating and limiting the sale of alcohol, particularly to minors, taxing alcohol to increase its cost, and providing education and treatment. Treatment of alcoholism may take several forms. Due to medical problems that can occur during withdrawal, alcohol cessation should be controlled carefully. One common method involves the use of benzodiazepine medications, such as diazepam. These can be taken while admitted to a healthcare institution or individually. The medications acamprosate, disulfiram, or naltrexone may also be used to help prevent further drinking. Mental illness or other addictions may complicate treatment. Various forms of individual or group therapy or support groups are used to attempt to keep a person from returning to alcoholism. One support group is Alcoholics Anonymous. The World Health Organization has estimated that as of 2016, there were 380 million people with alcoholism worldwide, 5.1% of the population over 15 years of age. As of 2015 in the United States, about 17 million, 7%, of adults and 0.7 million, 2.8%, of those aged 12 to 17 years of age are affected. Alcoholism is most common among males and young adults. Geographically, it is least common in Africa, 1.1% of the population, and has the highest rates in Eastern Europe, 11%. Alcoholism directly resulted in 139,000 deaths in 2013, up from 112,000 deaths in 1990. A total of 3.3 million deaths, 5.9% of all deaths, are believed to be due to alcohol. Alcoholism reduces a person's life expectancy by approximately 10 years. Many terms, some slurs and others informal, have been used to refer to people affected by alcoholism. The expressions include tippler, drunkard, dipsomaniac, and souse. In 1979, the World Health Organization discouraged the use of alcoholism due to its inexact meaning, preferring alcohol dependence syndrome. The risk of alcohol dependence begins at low levels of drinking and increases directly with both the volume of alcohol consumed and a pattern of drinking larger amounts on an occasion, to the point of intoxication, which is sometimes called binge drinking. Alcoholism is characterized by an increased tolerance to alcohol, which means that an individual can consume more alcohol, and physical dependence on alcohol, which makes it hard for an individual to control their consumption. The physical dependency caused by alcohol can lead to an affected individual having a very strong urge to drink alcohol. These characteristics play a role in decreasing the ability to stop drinking. Of an individual with an alcohol use disorder, alcoholism can have adverse effects on mental health, contributing to psychiatric disorders and increasing the risk of suicide. A depressed mood is a common symptom of heavy alcohol drinkers. Warning signs of alcoholism include the consumption of increasing amounts of alcohol and frequent intoxication, preoccupation with drinking to the exclusion of other activities, promises to quit drinking and failure to keep those promises, the inability to remember what was said or done while drinking, colloquially known as blackouts, personality changes associated with drinking, denial, or the making of excuses for drinking, the refusal to admit excessive drinking, dysfunction, or other problems at work or school, the loss of interest in personal appearance or hygiene, marital and economic problems, and the complaint of poor health, with loss of appetite, respiratory infections, or increased anxiety. Drinking enough to cause a blood alcohol concentration, BAC, of 0.03 to 0.12% typically causes an overall improvement in mood and possible euphoria, a happy feeling, increased self-confidence and sociability, decreased anxiety, a flushed, red appearance in the face and impaired judgment and fine muscle coordination. A BAC of 0.09% to 0.25% causes lethargy, sedation, balance problems, and blurred vision. A BAC of 0.18% to 0.3% causes profound confusion, impaired speech, e.g. slurred speech, staggering, dizziness and vomiting. A BAC from 0.25% to 0.4% causes stupor, unconsciousness, anterograde amnesia, vomiting. Death may occur due to inhalation of vomit while unconscious, and respiratory depression, potentially life-threatening. A BAC from 0.35% to 0.8% causes a coma, unconsciousness, life-threatening respiratory depression and possibly fatal alcohol poisoning. With all alcoholic beverages, drinking while driving, operating an aircraft or heavy machinery increases the risk of an accident. Many countries have penalties for drunk driving. Having more than one drink a day for women or 2 drinks for men increases the risk of heart disease, high blood pressure, atrial fibrillation, and stroke. Risk is greater with binge drinking, which may also result in violence or accidents. About 3.3 million deaths, 5.9% of all deaths, are believed to be due to alcohol each year. Alcoholism reduces a person's life expectancy by around 10 years, and alcohol use is the 3rd leading cause of early death in the United States. Long-term alcohol misuse can cause a number of physical symptoms, including cirrhosis of the liver, pancreatitis, epilepsy, polyneuropathy, alcoholic dementia, heart disease, nutritional deficiencies, peptic ulcers and sexual dysfunction, and can eventually be fatal. Other physical effects include an increased risk of developing cardiovascular disease, malabsorption, alcoholic liver disease, and several cancers. Damage to the central nervous system and peripheral nervous system can occur from sustained alcohol consumption. A wide range of immunologic defects can result, and there may be a generalized skeletal fragility, in addition to a recognized tendency to accidental injury, resulting a propensity to bone fractures. Women develop long-term complications of alcohol dependence more rapidly than do men. Additionally, women have a higher mortality rate from alcoholism than men. Examples of long-term complications include brain, heart, and liver damage and an increased risk of breast cancer. Additionally, heavy drinking over time has been found to have a negative effect on reproductive functioning in women. This results in reproductive dysfunction such as anovulation, decreased ovarian mass, problems or irregularity of the menstrual cycle, and early menopause. Alcoholic ketoacidosis can occur in individuals who chronically misuse alcohol and have a recent history of binge drinking. The amount of alcohol that can be biologically processed and its effects differ between sexes. Equal dosages of alcohol consumed by men and women generally result in women having higher blood alcohol concentrations, BACs, since women generally have a lower weight and higher percentage of body fat and therefore a lower volume of distribution for alcohol than men. As with similar substances with a sedative hypnotic mechanism, such as barbiturates and benzodiazepines. Withdrawal from alcohol dependence can be fatal if it is not properly managed. Alcohol's primary effect is the increase in stimulation of the GABA receptor, promoting central nervous system depression. With repeated heavy consumption of alcohol, these receptors are desensitized and reduced in number, resulting in tolerance and physical dependence. When alcohol consumption is stopped too abruptly, the person's nervous system experiences uncontrolled synapse firing. This can result in symptoms that include anxiety, life-threatening seizures, delirium tremens, hallucinations, shakes, and possible heart failure. Other neurotransmitter systems are also involved, especially dopamine, NMDA, and glutamate. Severe acute withdrawal symptoms such as delirium tremens and seizures rarely occur after 1 week post-cessation of alcohol. The acute withdrawal phase can be defined as lasting between 1 and 3 weeks. In the period of 3 to 6 weeks following cessation, anxiety, depression, fatigue, and sleep disturbance are common. Similar post-acute withdrawal symptoms have also been observed in animal models of alcohol dependence and withdrawal. A kindling effect also occurs in people with alcohol use disorders whereby each subsequent withdrawal syndrome is more severe than the previous withdrawal episode. This is due to neuroadaptations which occur as a result of periods of abstinence followed by re-exposure to alcohol. Individuals who have had multiple withdrawal episodes are more likely to develop seizures and experience more severe anxiety during withdrawal from alcohol than alcohol-dependent individuals without a history of past alcohol withdrawal episodes. The kindling effect leads to persistent functional changes in brain neural circuits as well as to gene expression. Kindling also results in the intensification of psychological symptoms of alcohol withdrawal. There are decision tools and questionnaires that help guide physicians in evaluating alcohol withdrawal. For example, the CIWAAR objectifies alcohol withdrawal symptoms in order to guide therapy decisions, which allows for an efficient interview while at the same time retaining clinical usefulness, validity, and reliability, ensuring proper care for withdrawal patients, who can be in danger of death.